Hello, my name is Umar Zaman Chaudhry, and my student ID is S334371. It's the presentation about the first slide, title slide. This presentation examines the merits and drawbacks of assertive communication in health and social care. The selected style is assertive communication, which is extremely relevant in a professional care practice. And there is a need for health and social care workers to communicate clearly with service users, families, carers, and other professionals. Uh, and then the slide comes about introduction. So, communication is a very significant skill to learn in health and social care. The reference or tool 2024. It is related to an understanding of their care, their sense of safety, and the trust of professionals. Failure to communicate can result in confusion, upset, uh, uh, grievances, or unsafe practice. Assertive communication is essential for professionals as it helps them communicate with clarity while still respecting the person. A care worker could have to provide an explanation of a care routine, a concern about a risk, or request assistance from another worker. The NMC code emphasizes that professionals should communicate clearly and share information appropriately, promoting safe and effective practice. And then the slide comes meaning of assertive communication. Uh, Assertive communication is the ability to assert views, needs, concerns, and information in a direct but respectful manner. It's the reference Presley 2022. Unlike passive passive communication in which the person doesn't speak up even when there is a problem, it is not that. In addition, it's not aggressive communication in which someone might talk in a blaming or uh, overpowering or disrespectful way. There are two extremes, and assertive communication is between them. This could be, for example, a statement in care settings of I am concerned about this change of condition, or can I clarify the care plan before we continue? This style is ideal for working professionals to maintain a respectful attitude while remaining responsible. And then the slide comes strengths of assertive communication. Assertiveness is one of the good qualities of communication. Uh, Communication in health and social care can be difficult and lead to serious issues, particularly when communicating about medicines, personal care practice, personal care, protecting people from harm, and to changes to health status. Assertive communication enables professionals to convey information in a clear and concise manner. It is the reference uh, FACID 2023. One of its benefits is that it gives dignity. A professional can disagree and correct misunderstanding or raise concern without embarrassing the other person. And then the slide comes limitations of assertive communication, slide 5. There's also some drawbacks to assertive communication. It is not effective when the professional's tone or body language is inappropriate. For example, uh, crossed arms, loud speaking, or hurried speech can convey an aggressive message when the words are appropriate. Additionally, there may be cultural differences in communication regarding assertiveness. There is the reference Al Hawaiti et al. 2025. Some people may prefer to communicate indirectly or feel uncomfortable when professionals communicate in a very direct manner. People who are distressed, confused, or angry are not always easy to communicate with assertively. In such cases, the worker might have to take a step back, listen first, and reassure before providing direct information. Then the slide 6 uh, comes application in health and social care. Assertive communication can be applied in many care situations. It is helpful when discussing a care plan, as the professional should provide clear information and respond to questions. There is a reference Callisto et al. 2023. It is also relevant when talking about consent, as the service user needs to be uh, aware of what is being offered and needs to be able to make a decision. So, and then the slide 7 comes linked to person-centered care. Person-centered care is about putting the person at the center of decision making. There's a reference Grover et al. 2022. This encompasses respecting their values, preferences, beliefs, culture, and personal circumstances. Assertive communication will assist this, enabling professionals to communicate clearly and listen carefully at the same time. A professional can ask open-ended questions like, "What is most important to you with regards to the care?" or "How would you like us to help you?" This makes it easier for the person to clearly communicate needs. Then the slide 8 comes verbal and non-verbal components. So the assertive communication is more than just what is said. This also relies on the delivery of the message. Verbal communication involves word selection, tone, pace, and volume. If the message is tough, using a calm and respectful tone makes it easier for people to accept. Nonverbal communication involves body language such as eye contact, facial expression, posture, and personal space. It is the reference Phillips 2021. These signals can enhance or detract from the message. For instance, if a professional states he or she is listening but looks elsewhere or some impatient, the service user may not feel respected. And now it comes slide 9, teamwork and collaboration. In health and social care, team working is vital, as service users may be receiving assistance from a variety of professionals. These can be nurses, care assistants, social workers, doctors, therapists, and family carers. So, assertive communication helps team members to share information clearly and to ask questions of anything that is unsafe or unclear. This is crucial as it can cause a lack of information or error if the staff do not work together well. SBAR is a helpful resource as it breaks down communication into four components: situation, background, assessment, and recommendation. Is the reference Ion et al. 2023. NHS England says SBAR is a tool to help minimize breakdowns in verbal and digital communications by establishing a common framework for handovers and urgent matters. Then the slide 10 comes conclusion and recommendations. Uh, in conclusion, assertive communication is a powerful communication style for the health and social care professions, as it helps to ensure dignity, safety, person-centered care, and collaboration. There's a reference to Tool 2024. It is recommended, however, it should be used with caution. It can be misunderstood if it is too direct. Ultimately, you're lacking in empathy. Assertive communication includes active listening, calm tone, respectful language, and sensitivity to cultural and emotional needs. And at the end, references come as is Al Hawaiti 2025, Callisto, and then it comes Clark 2024. uh, Facade is 2023, Global Health Education 2025, Grover, then it comes Monga, and then it comes O'Toole G 2024, Phillips A 2021, 21, Presley 2022, uh, uh, Yoshinaga 2025, Yunjay 2023, and all that. Thank you very much.